Well, thank you for joining us today during our webinar. I'm Allison Foster. I'm the Delta Mega Executive Secretary, and I'll be hosting today's presentation. So Delta Mega is the Public Health Honorary Society, which was founded in 1924. So yes, it is our 100-year anniversary, which is why we are hosting this fantastic webinar series. This is one of the ways we're celebrating our past 100 years is looking back and at public health milestones during each decade. So today's presentation is on public health in the 1970s, identification of Legionnaire's disease. It'll be presented by the Delta Psi chapter at Thomas Jefferson University. And the presenters today will be Olive Mowry, Rohit Babu Ramasetti, Emma Markley, Nina Diamond, Dr. Amy Leader, and Dr. Robert Sharar. So I'm very happy to introduce you all to them, and they go ahead and take it away.
Okay, thank you, Allison. Thank you for the opportunity to host this wonderful webinar. We are thrilled with the chance to showcase Philadelphia, our public health program here, and the unfortunate circumstance of Legionnaire's disease being discovered here in Philadelphia. As Allison said, I'm Amy Leader. I'm one of the faculty here in our public health program. I teach social and behavioral theory classes, as well as I guide students through our capstone research project. I'm doing our next advancing. Are you doing that? Okay. Yes. Where am I doing? Spacebar? The spacebar? No. There we go. Okay. I'm going to do a 2-second little background on our College of Population Health. I think it's really interesting to hear about all these different colleges and schools of public health across the country as we're doing these webinars over the year. So we are a Master of Public Health program embedded in a College of Population Health. We have multiple pathways to our degree completion. We try and reach all people that are interested in public health through our part-time program, our full-time program. We have an accelerated program. We have a partnership with employees here. There's a bridge program for undergraduates moving into a public health program, all with the ultimate goal of an MPH degree. Our program started in 2008. We have 6 full-time faculty and about 24 part-time faculty here with our students. At any one time, there's about 150 MPH students here in the program in any one of these pathways to a public health degree. And we have over about 350 alumni now since we first started in 2008. There we go. Oh, did I miss one? I think I might have, but that's okay. And I'll tell you a little bit about our Delta Psi chapter. So our chapter was more recently founded in 2019. And I would say that we really started to invigorate ourselves in 2023. We set our goal of increasing alumni and student interaction. That's the birth of this webinar and our greater involvement in Delta Omega. We also did a career alumni stories panel more recently. We're launching a buddy program for some of our current students, matching them to alumni. And we're here today to present this webinar. So next slide, please. And I'm going to introduce Olive, who is presenting remotely, not in Philadelphia today, but is a wonderful MPH student that we have here. So Olive, take it away.
Thank you so much, Dr. Leader. So my name is Olive Mowry, and I'm gonna set the stage for Legionnaire's disease. We're gonna flash back to 1976. A gallon of milk is 83 cents. Disco is alive and well. And it's the American bicentennial. So the United States is celebrating 100 years of existence. And the American Legion, an organization of US war veterans, are meeting at the Bellevue Stratford Hotel in downtown Philadelphia on Broad Street. Now, I'm just seeing the first slide. Is that, did we move forward?
Okay. Great. Sorry, everybody. We're going to continue on here. So go ahead, Olive. I'm going to present the slides. Here we go. Okay, going forward to get to where we left off. Okay.
All right, where were we? Disco, cheap milk, bicentennial. Next slide, please. Okay, so as I was saying, the American Legion is meeting in downtown Philadelphia. There's more than 2,000 members of Pennsylvania chapters who are there from July 21st to July 24th, 1976. 2 days after the conference, on July 26, 1976, a 63-year-old man has a fever, which develops into chills and a dry, hacking cough. He's admitted to a hospital on July 29th for severe pneumonia, and while he is discharged about 10 days later, some of his fellow Legionnaires are not so lucky. Others complain of headaches, chest pain, fever, and lung congestion. And of the 182 attendees that fell sick, 29 die by August of that next year. So investigators from the CDC returned to the hotel to try to find the cause of this mysterious illness affecting the veterans. They check wallpapers, carpets, and elevators in the hotel. They also examine pitchers for cadmium levels because that can sometimes resemble the flu. And they also look at the rooms of shut-in residents for any potential parakeets because they can spread a flu-like illness called psittacosis. It's not until December of 1976 that a breakthrough occurs when Dr. Joseph McDade, a CDC disease specialist, finds clusters of rod-shaped bacteria in the livers of guinea pigs injected with lung tissue from the Legionnaire's patients. With a few more experiments, he and his colleague, Charles Shepard, confirmed that it was a new bacterium, Legionella pneumophila, which was, of course, named for the Legionnaires whom it affected. And then it's not until January of the next year when another outbreak confirms Legionella thrive in the cooling towers of large buildings and was aerosolized through air conditioners during the conference at the Bellevue Stratford. And thus the mystery is solved.
Hello, my name is Rohit Babu Ramshetty. I'm doing the MPH EDM program here. And to getting into the clinical view of the Legionnaire's disease outbreak, so the outbreak led to an intensive investigation that resulted in the definition of Legionnaire's disease and the identification of bacterium responsible for the illness. This disease is also a severe form of pneumonia caused by bacterium Legionella, which leads to lung infection, inflammation, and severe respiratory symptoms. The transmission of this Legionnaire's disease is caused by bacterium Legionella, which is commonly found in freshwater environments. Inhalation of contaminated water droplets or aerosols can lead to the infection. And also this bacterium thrives in hot water, making hot tubes and large plumbing system potential source of exposure. Understanding these environments is crucial for preventing the spread of the disease. Individuals with weakened immune system, the elderly, and those with underlying health conditions are at risk of developing severe Legionella disease. The typical symptoms of this disease is such as cough, shortness of breath, chest pain, and resembling also of pneumonia. The patients may experience fever, muscle aches, headaches, and systematic impact of infection of the body. And also, it also leads to a great variety of gastrointestinal symptoms such as nausea, vomiting, and diarrhea. The risk factor or the vulnerable population for this disease are the people with weakened immune system, such as HIV, AIDS, or those who have undergone the chemotherapy for a long period of time. And those elderly, particularly with underlying comorbid conditions, are also more susceptible to this illness. And smoking and chronic lung diseases such as COPD and bronchitis also have a greater risk for developing Legionnaire's disease. Some of the diagnostic tools for this disease are detecting in the urine, which is rapid and reliable method for Legionnaire's disease. Respiratory culture, which separates of secretion from lungs, is also a great identifying factor for this. And X-rays and CT scans also reveal a great involvement of patterns in this lung. The early recognition of Legionnaire's disease is crucial for initiative, appropriate treatment, and preventing severe complications. Healthcare professionals must maintain a high index of suspicion for Legionnaire's disease, especially with those of risk factors or unexplained severe respiratory illness. The timely reporting of suspected and confirmed case to public health authorities is essential for effective disease surveillance and outbreak management. Legionnaire's disease can also progress to severe pneumonia and acute respiratory distress syndrome, ARDS, leading to respiratory failure and need of intensive care. In severe cases, Legionella infection can affect other organs, lead to complications such as kidney failure, septic shock, and neurological symptoms. The mortality rate of Legionnaire's disease varies based on factors such as age, underlying health conditions, and the timeliness of appropriate treatment, and also the detections of disease.
Hi everyone, my name's Emma. I'm a student in the accelerated program here at Jefferson, and I'm going to be sharing a little bit about the public health implications of the Legionnaire's outbreak. To start off, we wanted to provide a little bit of a modern day update on Legionnaire's disease. So from 2000 to 2019, there were over 82,000 confirmed cases of Legionnaire's disease in the US. The peak of this was in 2018 when there were close to 10,000 diagnosed reported cases. However, the actual number of cases per year is likely 1.8 to 2.7 times higher. This is attributed to the fact that Legionnaire's disease is hard to distinguish from pneumonia and also underreporting. Approximately 1 in 10 cases of Legionnaire's disease are fatal. At the bottom of the slide, I've highlighted some recent outbreaks in the US. So as you can see, there have been quite a few. The CDC considers anything over 2 diagnosed cases from the same source to be an outbreak. So all of these outbreaks had different causes. For example, the one in New Jersey, they're still investigating the cause. The Richmond, California outbreak was from a spa, and the outbreak in the Bronx was from 4 cooling towers. To jump into the public health implications, the Philadelphia outbreak highlighted the importance of 24/7 outbreak reporting and investigation. So when physicians began to see patients presenting with symptoms of Legionnaire's disease, they tried to report them to the Pennsylvania State Public Health Department. However, they were unable to do so because it was the weekend and they were closed. By the time that they reopened on Monday morning, 18 people had died. Since protocol has changed and now reporting is able to be done 24/7. The outbreak also highlighted the importance of communication during an outbreak. So this is sort of twofold. So the first is good communication between those who are investigating the outbreak, in addition to communication to the public on what's going on, the process of the investigation, because when this doesn't happen, there can be some large problems, which I'll get into in another slide. So as you can see on this little graphic from the CDC, 9 in 10 outbreaks of Legionnaire's disease were caused by problems prevented with more effective water management. To the left, we've highlighted some of the important primary prevention initiatives happening recently. And to focus on one in particular, in 2023, Philadelphia launched the Philadelphia Cooling Tower Analysis Project. So they decided to assess and identify all of the cooling towers in the city of Philadelphia in order to prevent possible further outbreaks. And lastly, the media can play a huge role in outbreaks. The Philadelphia outbreak of 1976 was highly publicized. The attention of the nation had already been on Philadelphia because of the bicentennial celebration a few weeks prior. So this sort of fueled that. And when communication is lacking to the public, this leaves room for the fueling of conspiracy theories. So 2 of the main conspiracy theories during the Legionnaire's outbreak in 1976 were that the outbreak was caused by nickel carbonyl poisoning. When they conducted autopsies on those who had passed from the disease, they found high levels of nickel. However, this was determined to be from the nickel instruments that were used during the autopsies, and those conducting the autopsies were asked to switch to metal or plastic tools, The second was that this outbreak was a fruition of the Andromeda strain, which was a 1971 film that had been released about an extraterrestrial deadly virus.
Okay, give me 1 second while we get set up for the interview portion. Okay, great. Thanks everyone for your patience. Thanks for our public health students for those amazing slides. We will come back at the end after our interview and we'll have some time for questions if anybody has any. So what we will do now is we're going to move into an interview with Dr. Robert Sherrar. My name is Nina Diamond. I graduated from the MPH program here at Jefferson, and I am the co-president of Delta Omega. So just to give some background on our special guest, Dr. Sherrar is an internal medicine and infectious disease doctor by training. He also became an epidemiologist following his time in the Center for Disease Control's Epidemic Intelligence Service. After completing this program, Dr. Sherrar became the chief of communicable disease division at the Philadelphia Department of Public Health. It was during his time in this role that Dr. Sherrar found himself responding to one of the greatest epidemiological questions of the century, the Legionnaire's outbreak. Dr. Sherrar is also a active member of the College of Physicians of Philadelphia, showing his continued dedication to the field. And just thank you so much for being here. It's raining in Philadelphia. It's not a great day to have to travel or anything. So we really appreciate you being here today and taking the time to, participate in this webinar. So we can jump into our first question. So can you tell me a little bit about how your career led you to the communicable disease division at the Philadelphia Department of Public Health?
Yes, well, when I was in medical school, I wasn't quite certain what sort of specialty I was going to do, but I was interested in international health because of I guess the idea that I was young and wanted to see the world. And I was lucky enough to spend the summer between my junior and senior year of medical school working in a mission hospital in West Pakistan. While I was there, I spent some time at the Lahore Research Laboratory from the University of Maryland and met a guy named Dr. Michael Gregg. I came back, did my 4th year of medical school, did my internship. And while I was doing my internship, Dr. Gregg called me and offered me a position in the EIS. And while I didn't know exactly a whole lot about the EIS, it sounded appealing, and so I immediately accepted it. When you join the EIS, you get down to Atlanta and you spend the first part of your first month or so in the service learning epidemiology and learning biostatistics. And Dr. Langmuir, who founded the Epidemic Intelligence Service, gave the first lecture on epidemiology. And in that lecture, he said, in medical school, you were taught to take care of the patient. I am going to teach you to take care of a population. And it hooked me. And it changed my life. And I've been doing epidemiology really ever since.
Yeah, that's great. That's a definitely a life-changing sort of quote and story and experience you had. So what were your areas of focus in the communicable disease division? What was your day-to-day like when you started working there?
Well, when I first started in the department, which is 1974, I ran the division of the chief of the communicable disease control section. And I was primarily responsible then for the immunization program and for any communicable disease outbreak that occurred within the city. So I was kind of the city epidemiologist. And I always viewed Philadelphia with its 1.5 million people as my patient. So it was a very interesting job. And most up before the Legionnaire's disease outbreak, I spent a lot of time reviewing case reports of salmonella, shigella, and hepatitis, that sort of thing, trying to see if there was a common source outbreak anywhere. Most of my time really was spent though on the immunization program because we had low immunization levels among many of our school children. In fact, in 1976, we had a major measles outbreak with almost 1,500 reported cases. So in the health department, we spent a lot of time organizing school immunization programs. Unfortunately, I had a nice staff that we were able to do it. And also back then, we used petajet guns and 50-dose vials of MMR vaccine. They don't do that anymore because of the AIDS epidemic and other things. But back then, it was all right. And we were successful in immunizing the school children to actually stop the epidemic. The epidemic actually ended when the school year ended, which is kind of what happens normally.
Makes sense. Sounds like you were busy. That's a lot.
We were busy, yes.
Yeah, very busy day to day. Okay, can you recall finding out about this mysterious flu-like illness, the outbreak? What was that like when you learned that this was happening?
Yeah, well, let me, I can tell you exactly how I found out
Okay.
about it. I went to work that Monday morning and a colleague of mine wasn't feeling well, so I was taking a look at him and I went back to my office and I had 4 lines coming into my office and all the lines were lit. And I didn't really know what that was all about. So I went to another phone and called Bill Parkins, who was the state epidemiology and a friend of mine. And he told me about the outbreak. So what happened is that the commandant of the American Legion for the state of Pennsylvania realized that there were a number of legionnaires who had been to the convention in Philadelphia died of pneumonia.
Mhm.
So he reported to the state health department and he reported to CDC. Now, these cases were scattered throughout Pennsylvania. They really weren't in Philadelphia, so I didn't know about it.
Mhm.
So that's how they identified it. Of course, once I knew about it, the cases originated in Philadelphia, but they got sick when they went home. Fortunately, the state health department invited the CDC to come up and join the epidemic investigation because it was really a statewide problem, and it was really more than either the state or the city could do by ourselves. And of course, CDC was the expert on it. So it was actually the largest investigation that the CDC had done up to that time. We had 23 EIS officers scattered throughout the state of Pennsylvania collecting data on known cases. In addition to that, they had hundreds of people working in the laboratory and a number of environmental engineers coming up, inspecting restaurants and hotels. So it was a major undertaking by CDC, and I think they did a remarkably good job with it, and we couldn't have done it without them.
Yeah, wow. So did that mean that you saw some of your old classmates from EIS?
Well, actually, the guy that came up to head the investigation was David Frazier, who had trained in infectious disease here in Philadelphia, and I knew him before he went to Atlanta.
Yeah.
So it was really bringing old friends together to work on the outbreak, and I did know a number of the people that came into the city, which made it very easy because we had an established good rapport before the outbreak occurred.
Yeah, that's great. Wow. Was this the first time you found yourself responding to a public health crisis of this level?
Well, not really. I mean, I think the measles epidemic that preceded it created a lot of publicity, and we had to respond to that. At the same time, if you remember back in 1976, they had the 12 cases of swine influenza at Fort Dix in New Jersey. And because of those 12 cases, and the federal government and the CDC instituted the National Swine Influenza Immunization Program. So we were in the process of trying to get the city of Philadelphia immunized against swine flu when this outbreak occurred. In fact, I think that's what made the outbreak so important, because this was an outbreak of pneumonia. And people initially thought that this might be the beginning of the swine flu epidemic. Fortunately, it was not. But that's what created a lot of interest in it from the very beginning. So we had prior experience dealing with the news media, and this was just a continuation of it.
Wow. And then did you speak with any patients who had contracted the disease?
No, actually, I didn't during the epidemic because there are other people doing it. Many of the cases were outside the city. I spent most of my time working with David Frazier and the people in the Philadelphia Health Department, collecting and analyzing the data that we had. I did interview several Legionnaires afterwards, though, who had been in Philadelphia and whose actually colleagues had died of the disease. We had gone to their community to see if we can find out more about what they did when they were in Philadelphia, to see if we can determine a possible source. So I did not get an opportunity to speak directly to the patients because other people were doing it.
Yeah, great. And then what do you think the Philadelphia Department of Public Health learned from this outbreak and this public health crisis?
Well, you always learn from a new outbreak because there are always different things are happening to it. I think the most important thing that I learned was first of all getting more experience in dealing with this sort of thing. But I really, because with CDC's input, we really did conduct the epidemic investigation, use what I call the general principles of epidemiology. the first two steps in investigating an outbreak is to verify the diagnosis and identify the existence of an outbreak. Now, we couldn't verify the diagnosis at the beginning. All we knew is that it was a pneumonia. And of course, pneumonias can be caused by viruses, by toxins, by bacteria, by rickettsial, but even parasites. So we really didn't know which one we were dealing with at the time. But obviously we knew the epidemic was real, so we had verified the diagnosis. And then we began, the next phase in the investigation was to characterize the distribution of cases using the epidemiologic variables of person, place, and time. And as the data came in, we did that, trying to determine where the outbreak occurred or see if we could learn anything from it. And one of the first things you do is you take a look at the epidemic curve. Before we get to the epidemic curve, the very first thing we had to do was to create a case definition. Since we had no laboratory way of doing it, we had to create a definition. As I said, there are a lot of different causes of pneumonia. So the definition we created had a clinical component, which was that they have to have an abnormal chest x-ray or a fever above 102, et cetera. And then we had to add to that an epidemiologic definition because we wanted to focus on the epidemic. And the epidemiologic criteria was that the individual had to be inside the hotel, Stratford. We also began to get a lot of information about people who had pneumonias that were on Broad Street in front of the hotel. So we developed a Broad Street pneumonia definition as well. So we had two cases we were concentrating on. We were concentrating on those people who had Legionnaire's disease and were in the W Stratford. And those cases that were on Broad Street, they also developed pneumonia. Now, we had many other cases of pneumonia reported to us from throughout the city, but we didn't consider them part of the outbreak. We considered them endemic background cases and focused only on the cases that helped. Early in the outbreak, we were able to take a look at the epidemic curve of both Legionnaire's disease and Broad Street pneumonias. And what we observed was the epidemic curve for Legionnaire's disease went up sharply, came down, and then kind of spattered a little bit more in the first part of August. That told us that this epidemic curve was most likely caused by a common source outbreak. And the common source outbreak occurred, and then it kind of waned and disappeared. The other interesting thing is when we look at the curve for the Broad Street pneumonias and the curve for Legionnaire's disease, they were kind of identical, although the Broad Street pneumonia had a smaller number of cases. But it did suggest that they were part of the same outbreak. And later on, whenever Dr. McDade isolated the organism, we developed the fluorescent antibody test for it. We were able to actually test, and we were able to confirm that there were cases of Legionnaire's disease and Broad Street pneumonias were in fact part of the same outbreak. So whatever happened back then happened during the Legionnaire's convention when it was most intense, but it did continue through the first week of August, then disappeared.
That's so interesting to learn about that.
The nicest thing about that outbreak was that it disappeared on its own before we knew how to do anything about it.
Okay, good. Resolved itself to some extent. Wow, that's so fascinating to hear. The step of everything, and
but it does. Stick with the fundamentals you're taught in epidemiology. It really work.
Let me tell you, that was a hard class for me. So it's not for everyone, but I'm so glad there's people who are really good at it.
Just to continue, we did the descriptive part, but then we ended up doing even case control studies. We selected cases and controls and did a questionnaire to see if there was any difference between the two.
Wow.
So we really did bring in all the tools that the epidemiologist uses to evaluate diseases.
Yeah. Wow. So interesting. Great. And then did you feel like the media was affecting the outbreak in any way at the time? I know Emma talked about it a little bit, but yeah.
I think the media was very important.
Yeah.
This outbreak reached international publicity.
Wow.
I had a friend of mine who was working in the Amazon jungles of South America, and he told me later on, Bob, I heard of your outbreak.
Oh my God.
Of course, it wasn't my outbreak. It was the federal outbreak. So, and I think that was good because one of the things in conducting an investigation is to look around for all of the cases. And I think we really did identify all of the cases that were part of the outbreak.
Wow.
Because everyone was so aware of it, and we had hundreds of reports of pneumonia, so we had to really focus in on them. But the news media can be very helpful, but you have to be very clear with them.
Yeah.
You've got to keep your story consistent and you got to make it as clear as you can make it because they transmit it. I think in some ways we're lucky back then because we really did have the news media and we were able to deal with them. I mean, we had separate people doing it while we did the analyze the data. Nowadays, I keep thinking of the COVID epidemic whenever the internet produced so many, what I call disinformation. And I think that's the one thing you have to be careful of.
Yeah.
That disinformation can get disseminated very quickly and you have to try to prevent that from happening.
Right. There's so many streams of media now that
Yes.
it's hard to control, but I'm glad to
It's-
hear that it wasn't.
It's impossible to control.
Yeah, so there wasn't really anything too harmful or negative that was.
I don't think,
spreading.
no, I don't think the news media was negative. I think it was beneficial for us
Good.
back then.
Yeah, that's great. That's what you want. That's great. Okay, in closing, last question. Why do you think public health is important when it comes to disease surveillance and control?
Well, you know, it's interesting, as a physician, you know, if a patient is sick, they come to you with with their symptoms and with their complaint. But if the city's sick, what does the city do?
Yeah.
The city has no place to go. I mean, so what we have to do, and I think surveillance is fundamental with public health. You've got to know what's happening in the community. And you know, way you know that is by having reporting of diseases and reporting of outbreaks and people, you know, calling with questions about disease. So you gather all this surveillance data and you try to make sense out of it. And that's what we did in the health department. We try to make sense out of the data we get.
Great.
So, it's very important. I believe very strongly in public health.
Great. Thank you so much.
I just have one,
Yeah,
the other comment. I want to wish all of you students well, because I think public health is one of the most interesting and rewarding things you can do with your life. It's fascinating, it's fun, it's interesting. Good luck to you all.
Thank you so much. Thank you. Well, it's so great to have the firsthand experience and to hear from somebody who's dealing with this, you know, from the beginning to the end. So what we'll do now is we will just open it up for discussion and welcome any questions that Dr. Sharrar or any of the public health students can answer. See, there's some stuff in the chat. Oh, lots of thank yous for you.
Lots of thank
Everyone's
yous.
saying, well, thank you, Dr. Sharrar.
Already have a comment in the Q&A, if you can see that, Nina.
Yeah, let me pull that up. Okay. I would love to hear more about public health situations, about how public health situations were communicated to the public at this time. Now with social media, you could tell tens of millions of people about something instantly. Our challenges are combating misinformation. What were the communication challenges then?
Well, I think back then, one of the most important things is to keep your story straight. And when you talk about the number of cases, make sure that number doesn't change, or if it does change, it goes up, it doesn't go down. And part of the problem is you create your case definitions, and as you collect more data, the numbers may change. You have to be very careful in dealing with the news media. But what was the first part of the question?
Yeah. Just to hear more about how how public health situations were communicated at the time.
Yeah, now I forgot that one thing I want to emphasize about the communication, because epidemics do not occur by chance. They occur by a unique combination of events that harmful agents come in contact with susceptible hosts in the proper environment. Now, and it has an impact on the community. People ask me, what impact did the Legionnaire's disease have in the community? And if you think back in 1976, that was the year of the bicentennial. We were expecting huge crowds to Philadelphia. And in August, there were no lines at the Liberty Bell. People stopped coming to Philadelphia. And we had the Eucharistic Congress also taking place that first week in August. And I think that the attendance there was even decreased because of the epidemic. But I do think you have to pay a lot of attention. Maybe I used to say that investigating an epidemic was 80% politics and 20% facts. And under the politics, I refer to the news media. You really have to work at keeping the news media so they understand what's going on to the best of your ability. I think that's the most important lesson you learn as you investigate outbreaks. Now, with the social media out there, we didn't need, I mean, we had plenty of publicity of that. Social media, I'm not so sure is beneficial. It really is, because you do get too much disinformation, and that's not helpful.
Great. We got another question in here. How were you able to determine that the data collected was good quality data and decide which data to exclude?
Well, the cases were interviewed by EIS officers who are physicians and for the most part trained to collect the data. And I think the data that were received was fairly accurate. You know, when you do public health and disease surveillance, you do create case definitions, because people do report to you using different terminologies to describe the same illness, or they may use report different illnesses and as misdiagnosis. So you really have to pay attention to the information, make sure the case you're looking at really does fit the criteria for how you're establishing the case. And we did that.
We have another question. So much has changed throughout public health history. How do you think advances in technology, such as data analytics or telemedicine, are shaping the future of public health?
Well, I think it's beneficial. First of all, you know, when I was doing public health, and even before the Legionnaire's disease, we had no computers in the health department. We did everything by hand tabulation. And nowadays, in fact, when CDC came up, they brought computers up to actually enter the data into it so we can analyze it, because we didn't have the computers to do it ourselves. I think computers are a godsend, because you can analyze large databases. You can collect data on populations. You can analyze it much more quickly. And I think that makes the future of public health even better. That you have to be more sophisticated and know how to use all this stuff. I'm still learning.
Yeah. Great. Any other questions? Yeah, go ahead, Amy.
Can you hear me?
You're-
Dr. Shar, I have a question for you. So we are anticipating the 250th anniversary of Philadelphia in 2026, expecting a large crowd again. Also, the World Cup soccer tournament is happening here, and Major League Baseball is having their big event here. So what lessons learned should we bring forward to the 250th for the health department?
Well, I think you got to make sure you have a health department staffed with people who are trained to do epidemiology. And I think you also need to develop whatever you can surveillance sources. And I think with all the hospitals we have in our community, if we can link up a surveillance system where diseases automatically get reported to the health department, that would be beneficial. I think the thing is to detect what's happening as early as you can and verify the diagnosis to the best of your ability, because that's really the beginning of the investigation.
Great. I'll add one more pop quiz question, and then we'll come to a close. Do you know the musician who made a song about Legionnaire's disease? Have you seen this?
I have not seen that.
Bob Dylan wrote a song about Legionnaire's disease.
Oh,
If
did he?
anybody wants to check it out, maybe we'll play it here after we leave the
I would
webinar.
love to.
Yes, it's called Legionnaire's disease. I know. So how to add that?
It never made the top 10.
I don't think so. I don't think so.
Oh
Great.
my goodness, thank you so much. That was absolutely fantastic. That was a wonderful, wonderful webinar. We will be recording this and sharing it online. So I know others will be delighted to watch it as well. And to anybody participating, our next in our series is on June 4th. The Tau chapter, University of South Florida, is going to talk about AIDS in the 1980s. So thank you again, everybody. This was fantastic. Have a great day. Bye-bye.
Thanks, Allison. Thanks, everyone.
Bye-bye.
Bye.